Edo State Deputy Governor wey still be chairman of the Primary Healthcare Task Force, Right Honourable Idahosa, don again talk say Okpebholo's government dey serious to give better and easy to reach healthcare to everybody for Edo State. People wey tanda for the meeting na all the 18 local government chairmans dem, religious leaders, security people, health workers and staff from Edo State Primary Healthcare Development Agency, among others. Oga Idahosa yarn this one for the second quarterly meeting of the Edo State Primary Healthcare Task Force wey shele for Festival Hall inside Government House for Benin City. Im talk say the reason wey dem gather na to look how far dem don go and see wetin dem still need make dem do better. Honourable Idahosa come still remind everybody say primary healthcare na one of the main things wey dis government dey focus on, and come yarn all the local government chairmans dem say make dem hold their healthcare centers well so that people wey dey for grassroots go fit get healthcare near dem. A constant talk say,
I welcome you all to this second quarterly PAC task force meeting. Your collective dedication and unwavering commitment to strengthening primary healthcare services in Edo State do not go unnoticed. From policy makers to frontline health workers, from community leaders to development partners, you all are driving change, ensuring that the Edo healthcare system evolves to meet the needs of our people. Looking back at the inaugural meeting, we came together as a unified front, recognizing the urgency of our mission to build a more efficient, accessible, and well-coordinated PAC system. That meeting set the foundation for collaborative efforts, guiding us to think critically about the gap within our healthcare system and the practical steps needed to address them. Today, we reconvene not only to reflect, but to evaluate our progress, identify challenges, and recalibrate where necessary. I request that all stakeholders provide updates on action taken since our last meeting, offering insights into progress achieved, barrier encountered, and area require stronger interventions. It is through this discussion that we all refine our collective approach and ensure a resilient and responsive PAC system in Edo State. Under the visionary leader of distinguished Senator Monday Okpebholo, the Executive Governor of Edo State remains steadfast in its commitment to delivering quality healthcare to every citizen. Primary healthcare is the most immediate and accessible form of care for all our people. It is the cornerstone of our administration health agenda. We recognize that strengthening PAC services leads to a better immunization coverage, improved maternal and child health outcome, a greater trust in our health institution. For this reason, we will continue to champion policies, reform, infrastructure development, and healthcare workforce investment that position Edo State as a model for sustainable health delivery. However, let me reaffirm an undeniable truth that the success of this initiative does not rest solely on the government's shoulder. It is a shared responsibility that requires the commitment and expertise and dedication of every stakeholder represented here today, from public sector officials to private contributors, from community advocates to frontline workers. We all have crucial role to play in ensuring that every Edo citizens have accessible and reliable quality healthcare service. Every effort counts, every initiative matters, and every action taken today shapes the future of Edo healthcare system. Local governments must take ownership of PAC in their domain in ensuring that health facilities function optimally, healthcare workers are adequately supported, essential service reach the grassroots, chairing local government meetings, attending PAC planning sections, and providing logistics support are not optional. They are crucial responsibilities that must be upheld. Strong local government leadership in PAC will drive community engagement, increase accountability, and improve health outcome at their grassroots level. As we proceed today's deliberation, let us do so with urgency and purpose, and let our discussion be solution-driven. All commitments be action-oriented, and our vision remain unwavering. Edo deserves a strong, functional, and inclusive health system, and together we will build it. Thank you all for your dedication and contributions, and your shared commitment to healthier Edo State. Let's keep pushing forward, ensure the primary healthcare system remain accessible, impactful, and transformative for all.
Earlier, for a welcome talk, the Executive Secretary of Edo State Primary Healthcare Development Agency, Dr. Costin Osohia, come thank the governor and in deputy Wella for how them know they joke with healthcare matter. He come talk say make federal, state and local governments work together well so that PHCs go fit work better. He also salutes development partners where they help for things like immunization, disease monitoring and better service delivery.
I would like to extend our profound appreciation to His Excellency Senator Monday Obewolo, the Executive Governor of Edo State, whose forward-thinking leadership and consistent investment in the health sector continue to lay a strong foundation for sustainable reform in healthcare. The strides we are making here today are possible because of his vision. To Your Excellency, the Deputy Governor and the Chairman of this great task force, thank you for your active leadership, your accountability-driven oversight, and your relentless pursuit of PAC system that truly works for the people of Edo State. Your dedication set a tone of urgency and excellence that inspire us all. Distinguished colleagues, the mission before us is urgent as we know there's an outbreak of diphtheria in the state. To make primary health care the front door of our health system that is responsive, accessible, and trusted by all, we have made a meaningful progress. More functioning facility, broader immunization coverage, and improved coordination. But we are far from where we must be. Across our local government areas, so many facilities remain understaffed, which is a major problem in our health facility. The shortage of skilled health workers at the front line continue to weaken service delivery, leaving community underserved. Funding for basic PAC's operations such as drug procurement and cold chain maintenance is inconsistent, thereby threatening the continuity of care. Even where services exist, awareness is lacking. We must do more to help our citizens understand that PACs offer these services, which include free immunization, antenatal care, treatment for common diseases, and others. No family should be denied care because they do not know where to go or what is available. We must also fully activate the leadership role of our local government chairmen, particularly in the capacity of the organ. The support you bring, such as the financial support, administrative and thorough community engagement, is indispensable to success. Your influence can open doors that technical expertise alone cannot. So we need you to achieve this great success. The success of primary health care rests on coordinated actions of the federal, state, and local governments. Each time must rise to its responsibility, be it funding, staffing, oversight, or community engagement. When any level falls short, our collective efforts is weakened.
Commissioner for Health Dr. Cyril Shomole for im part come chook mouth on top some of the disease cases wey Edo State Healthcare dey handle, say 3 pipo don kpai from diphtheria and 7 confirmed cases of dengue fever. E come here and say local government chemos dem must help carry awareness reach grassroots and teach pipo about health, say na something wey no dey optional.
When we held our inaugural meeting, we set a clear vision to build a responsive, resilient, and people-centered primary healthcare system in our state. Today, we are faced with a true test of that vision. A diphtheria outbreak spreading across several local governments, states in the country, including ours. An emerging threat of dengue fever in our communities. As of June 18th, we have recorded 7 confirmed cases of dengue fever at Ira Specialist Hospital. At the same time, we are actively battling an ongoing diphtheria outbreak, which has already affected vulnerable populations and claimed 3 lives. In response, we have commenced reactive diphtheria vaccination for children aged 5 to 14 years in the affected areas. I want to commend our surveillance officers, routine immunization team, and disease control unit for rising to the occasion. But we cannot do this alone. We must act together. We must act now. Local government and support is critical. I appeal directly to all our local government chairmen present or represented here today. Your role in this fight is not optional. We urgently need your support in providing logistics for our vaccination teams and surveillance officers in the field. Without transportation and security, our staff cannot reach remote communities, and delays could be deadly. Enforced community sensitization, misinformation, and fear are as dangerous as the disease themselves. We need to intensify grassroots sensitization using town criers, market women associations, religious leaders, and youth influencers. Let our people understand what diphtheria and dengue fever are, how to prevent them, and why vaccination is safe and necessary. Strengthen partnerships. We are already working closely with Nigerian Center for Disease Control, NCDC, and I want to thank the Director General and his team for their technical guidance and willingness to support. We also appreciate the University of Benin Teaching Hospital, especially their public health and infectious disease department for their ongoing diagnosis support and capacity building. However, we must formalize and deepen this collaboration, sharing surveillance data, aligning outbreak response strategies, and coordinating public health communication.
To support wetin dem talk, council chemos dem of Owan West and Owan East, Honourable Joy Ohonyo and Honourable Haruna Mohammed come yarn say dem go return to their communities to put everything wey dem agree for the meeting into action.
Even before the invitation of the Deputy Governor today, I was supposed to hold a serious meeting with the traditional rulers, the ward chairmen, including all the HODs in the office, regarding to the sanitation that is coming up next week, Saturday. So based on the meeting, I have to shift the meeting to next week, maybe by Tuesday, maybe or 2 days before the sanitation, so that if we discuss anything concerning sanitation, they will not forget before the sanitation day. So I want to assure the public that what we are doing in Edo State today, by the time we are through with all the plan that the deputy governor is bringing now, Edo State will be the #1 on environmental sanitation.
The meeting that we had today, I will say that what my local government will do to ensure that they implement the issues that we have discussed today is #1, that I, as the local government chairman, I will do everything possible to support the task force and to the task force that was just constituted, and to also support the HOD environment to ensure that they engage in smooth running in my local government and level. And also, I will also provide the necessary facilities that they need for them to ensure smooth running in my local government.
Make una no forget say as we see am, na so we dey talk am. We no dey take blame. Ekata Ojesele, TMC News.